Hi, my name is Taylor Neary, and my partner Britt and I will be discussing the pharmaceutical drug Warfarin. I would like to introduce you to Rosie Fisher. She is 22 years old, living in Mansfield with her partner. She works as a florist 3 days a week and is in her 4th year studying law. Rosie loves the snow and spends nearly all of her time in the winter months skiing. Rosie ruptured her ACL while skiing and was immobilized for a prolonged period of time awaiting reconstruction surgery. After the surgery, she experienced calf pain and swelling, which was then diagnosed as deep vein thrombosis, or DVT, as it will be referred to for the remainder of this video. Rosie's mother has a history of DVT in which she took Warfarin. Rosie is currently taking Warfarin alongside a high-dose oral contraceptive. Warfarin is an anticoagulant. It targets the vitamin K reductase complex subunit 1. It acts by inhibiting the synthesis of vitamin K-dependent coagulation factors. Often these drugs are referred to as blood thinners. However, Warfarin does not thin the blood. It prolongs the process of forming a clot. Warfarin is administered orally and is rapidly and completely absorbed from the GI tract. It has peak concentration within the first 4 hours. It has a small volume of distribution and can last in the distribution phase anywhere from 6 to 12 hours. Warfarin is metabolized by hepatic microsomal enzymes to inactive hydroxylated metabolites. It is eliminated almost entirely by metabolism, however, a very small amount is excreted unchanged in the urine.
So now I'm going to be talking to you about the clinical aspects surrounding Warfarin and its use. Firstly, to dosage and administration. This is generally determined by the age of the patient as well as their underlying condition. The dosage is then monitored and continually adjusted until the target international normalized ratio for clotting is achieved. The duration for anticoagulation therapy for first-time DVT sufferers is generally between 3 and 12 months. As Rosie's leg is no longer immobilized, and that is no longer a playing factor in her condition, it is estimated that she will only need to use Warfarin for probably around 3 months. So some of the adverse reactions to Warfarin include under-anticoagulation, resulting in thrombus, and over-anticoagulation, resulting in dangerous bleeding episodes. These two things can occur when the dosage isn't probably managed correctly. So other adverse effects, such as necrosis, osteoporosis, valve and artery calcification, as well as others, have also been documented in the use of Warfarin. So Warfarin is subject to many interactions, both with other drugs as well as things such as food and environmental factors. So if a patient is taking Warfarin, they should consult their doctor before starting any other medications, whether these be prescription, over-the-counter, or even things such as vitamins and minerals, as they can all impact the effect of Warfarin. Some examples of this is some non-steroidal anti-inflammatories, as well as aspirin, can both enhance the anticoagulation effect, resulting in the likelihood of harmful bleeding. At the other end of the spectrum, things such as St. John's worts, as well as oral contraceptives, has been shown to reduce the effectiveness of Warfarin. So this is relevant to Rosie as she uses an oral contraceptive, and it may be important for her and her doctor to have a conversation about other contraceptive methods that may be safer to use with her condition. So certain foods as well as alcohol also have a significant impact on the way Warfarin works in the body. So alcohol affects the body metabolism of Warfarin. The antiplatelet effect of alcohol increases the risk of major bleeding, even if the INR remains within the target range. Some foods can interfere with the effectiveness of Warfarin, and it is recommended for patients to generally stick to their regular diet, but not to make any major changes without talking to their doctor first. This is because things such as having foods rich with vitamin K can make Warfarin less effective, potentially increasing the risk of blood clot. Warfarin is an S4 poison, which means it is prescription-only medication. It's also a category D when it comes to pregnancy. This drug is able to pass through the placental barrier and may result in a multitude of problems for both the mother and the baby. The Warfarin is used in the prevention and treatment of venous thrombus and pulmonary embolism. This is the reason behind Rosie's prescription. Other examples that I won't go into today because of the time restrictions are cardiomyopathy, atrial fibrillation, cerebral embolism, and transient cerebral ischemia. So some of the contraindications are pregnancy, which I've already talked about today. It's also important to consider whether the harm of potential hemorrhage may be greater than the potential clinical benefits of the anticoagulation. This may be relevant for some patients with specific medical conditions, but it's not too relevant to Rosie. So negative outcomes of Warfarin. It does have a narrow therapeutic index, which can be a problem as it can be a dangerous drug to play around with. It also has a number of challenges which I've talked a lot about today. So some of the positive outcomes, although it is a challenging drug to manage, which I've mentioned, if it's used appropriately for Rosie, the drug can be very effective in her treatment of DVT.